Well, good morning, Rotary District 7770, and welcome to Conversations with Rotary Action People for Friday, October 16th. My name is Donald Hovis, your CWRAP host from the Chicora Rotary Club in Myrtle Beach, South Carolina. We're pleased to be joined this morning by Janet Carlson, who is the CEO of the Surgery Center at Midlands Orthopaedics and Neurosurgery. Good morning, Janet.
Good morning, everyone. Thank you for having me.
We're excited about your presentation. Should be something very interesting. So we'll get to your questions in just a few minutes. Introducing your CWRAP team, our public image chair for our Rotary District from the 5 Points Rotary Club in Columbia, sporting the End Polio Now shirt with the purple wig, Mary Gask. Good morning, Mary. And our man that Rotary Does, sporting the Rotary Does shirt. He's our district communications officer. He's in full screen mode right now, but he might slide in. From the Somerville Evening Rotary Club in Somerville, Mr. Terry Moore. See, there you go, sliding in. He's working at all times, so thank you for what you're doing, sir. Those of you on Zoom, thank you for being here. Those of you over on our District 7770 Facebook page, thank you for being here as well. We want to know who you are. So we want you to use the chat box to introduce yourself with your name, your Rotary Club, and answer this question. It's actually 3 parts. So today, October 16th, is Department Store Day. So we want to know your favorite department store. It is also National Sports Day. So we want you to put in your favorite sports team. And then last but not least, happy hour was last night, but we're still talking about happy hour now. It's National Liqueur Day. So if you have a favorite liqueur or liquor, put that in the chat box as well. So want to know what you're all about. And if you have questions for Janet throughout our presentation, please post that in the chat box as well. And we will ask those to her at the end of the segment. So Janet, I would love for you to talk a little bit about the Surgery Center at Midlands Orthopaedics. Talk to us a little bit about that.
So we have a freestanding facility here in Columbia, South Carolina. It is a 4-room, when I say room, meaning operating room, facility that's, again, freestanding. So we're not affiliated with a hospital at all. We are owned by our surgeons, and we do straight ambulatory procedures here on very healthy patients that meet our criteria in a very safe environment here. And people go home same day of surgery, get home to the comfort of their own bed. So it's a new way for patients to have the same great outcomes, but they get to avoid the hospital. So people here are healthy. We don't have any sort of potential for COVID, flu, other things like that here, because this is elective and it's ambulatory.
Very neat. So you're located obviously in the Midlands, so you're in Columbia.
Correct.
All right. And you probably have patients that come from all over the state?
We actually have patients that travel here from around the world. We have a surgeon here that is famous for what his procedure is called hip resurfacing. Dr. Gross, and so he has quite a following, and we have patients that fly in from all around the world to have the surgery here, which is something that many people don't know, that we have this talent set here.
That's awesome. So how many surgeons at the Surgery Center?
22.
Awesome.
And growing.
That's great.
Which is exciting, yes, because we're private practice, so it's wonderful for us to stay in private practice and not go into an employment model with the large healthcare systems.
So we're going to be talking about robotic knees and things like that today, but what other types of surgeries do you do at the Surgery Center if someone was interested or in need?
We are orthopedic, neurosurgery, pain management, and urology. So basically, any bone in your body that breaks, we can fix it. Any soft tissue, muscle injury, we can fix it. Obviously, any urology needs, if people have kidney stones, things like that, we can remove those. And then we have neurosurgeries here where we will do stabilization of your spine called an anterior cervical discectomy infusion, where we approach the spine, the anterior approach via your neck. We also do a lot of lower lumbar procedures. And the newest procedure we're doing that many people have never heard of is called an SI joint fusion. And it's your sacroiliac joint, where a lot of people have had referred pain to their lower back for years, but it doesn't require surgical intervention on your spine. And so these patients, unfortunately, have been managed with chronic pain medications. There's this new technology where we go in and we stabilize the joint with 3 implants, and patients are now able to wean off their medications, have a greater quality of life, and they're thrilled to tears because they've got their mobility back.
That's excellent. So tell me what the name Rosa stands for and what is it designed to do?
So Rosa has taken on a personality in our facility here, but Rosa, ROSA, stands for Robotic Surgical Assistant. And so Rosa is designed to help us with reproducible outcomes that are accurate, that are specified to each patient. So it's a brand new technology, and it's very exciting, and I'm thrilled to be the first facility in the state to have this. So that's remarkable for a small surgery center like ourselves to be this technologically advanced ahead of the hospital systems. And we are the 3rd surgery center in the United States to have this technology.
That's excellent. So tell the viewers here the advantages and benefits for the total knee replacement.
So what we do here is we take images of the patient with X-ray, and once we have these X-ray images taken, we upload them to the robot, so each procedure has a personalized approach. So this is bringing together our skilled surgeons and the robotic technology here with our industry-leading knee implants that we have. And so each patient has a personalized surgical experience. Rosa Knee is, like I said, robotically assisted surgery system, and it will help us perform the total knee replacement surgery with, like I said, tissue sparing, more accurate cuts to the bone. So those features with what we call a bone resection, and it'll also assess the state of the soft tissue in order to make sure that we are positioning the knee implant exactly where it needs to be for that individual intraoperatively. So the data that we have, the data points where we combine the imaging, Rosa will assist with the complex decision making that we do and enable the surgeon to use the software and computer technology to help control and move the surgical instruments, allowing us to make greater precision and accurate cuts to your bone when we do the knee implant. I know that's a long answer, but I just want you to understand it's a very, very well thought out, organized, developed system.
Yeah, very interesting. So explain how this data is used for the orthopedic surgeon to carry out a personalized approach for the surgical patient.
So each surgeon, they'll create a plan for your surgery based on your unique anatomy. So the robot will help to ensure that that specific plan is executed by that orthopedic surgeon while you are in our operating room. So Rosa uses a camera and optical trackers. So when you have the incision made, we have trackers that the robot will take measurements on and use that data input to make sure that we have the correct degrees and angles for our cuts. And then it helps us know where your leg is in space at that time with a 3D image. And then it'll allow us to adjust accordingly by that data that's obtained with the trackers. So the Rosa Knee will provide that data, and then what we'll do is we'll adjust people have degrees of what's called valgus or varus, and you're talking about somebody that was bow-legged. This will help us adjust the joint so that we can allow for that person to not be bow-legged moving forward. And it's using those degrees that are captured in the imaging to do that. And then your case is significantly accurate with the cuts. And we have much more reproducible incisions and bone resections than a conventional approach.
Wow, this is some interesting things. So we have several questions posted in the chat box, and we'll be getting to those here shortly.
Great.
What should patients expect post-operatively about after having a robotic total knee replacement at your surgery center?
So you should anticipate that you're not going to be allowed to drive for at least 2 weeks. And of course, remember, it depends on the extremity that you're having operated on. So if it's your right leg, it's not likely you're going to be able to drive for at least 2 weeks or greater. Left leg, of course, you could probably get away with driving around 2 weeks' time. But people that like to garden, 3 to 4 weeks, you can start doing that activity. And then a lot of our patients will come back to us in their post-op visits and say they're back on the golf course 6 to 8 weeks post-op, which is astonishing. But it's wonderful. I love hearing those stories. But you know, each activity is up to you and what your pain threshold is and how you're doing with your physical therapy and your rehab. And of course, that's a decision you'll make with your surgeon post-operatively based on, you know, how you're doing and how you are feeling. But, you know, these patients also are not having to use the typical amount of narcotic pain medication because we have more accurate cuts and less tissue disruption. So there's also reduction in the long-term pain post-operatively that has been measurable, which is exciting as well.
And do your patients have to do anything additional in preparation for surgery?
So yes, we have them after they have met with our surgeon and they've had the consultation and they have come to a surgical plan, the surgeon and the patient, then we have them take x-ray imaging ahead of the surgery date with us. And that way, because it's in advance, we can use those images and upload them to the robotic platform. And then you have a personalized preoperative plan for each patient and your anatomy. It also ensures something that a lot of people would appreciate. It ensures that we are using the most minimal amount of radiation necessary to achieve these images. So that's important as well.
Excellent. And we'll get to your questions or the questions in the chat box here in just a second.
Sure.
I do want to say the district has come up with a purple, pinky, polio power in polio now background. So if those of you on this call are doing Rotary themed conference calls over Zoom in the month of October, you can download this background and put it as your virtual background for upcoming Rotary events. And then I just want to go through a couple of those responses on the questions of the day. We got some Seahawk and Packer fans in here. We got, let's see, we got an Amaretto fan here. Nordstrom's, the Clemson Tigers, Contro. Did y'all know Somerville was the birthplace of sweet tea? Like, I love how Terry puts that in his thing every time. Macy's at Christmas time. I like that. We don't have a Macy's where I am. Another Clemson Tigers, bourbon. Let's see here. College basketball. So we got a college basketball fan. Grand Marnier. Belks, I agree. The Yankees. Amaretto. Look. Total Wine. Total Wine, favorite department store. Bob Gross, you got it going on, buddy. Sorry to call you out. But you're a Gamecock fan, so even better, sir. Thank you. And then you like some rum chata. And I've had some fun, and I put in there the Atlanta Braves. We need one more victory to go to the World Series. Come on, come on, come on. And then I was the certified DD for our district. So if you need someone to drive you around, you can call me. And Mary Gask. All right. So questions from the audience. So who is the highest risk for knee replacement?
That's a great question. Those would be patients that possibly have any cardiac issues, may have had some cardiac surgery before. So those are patients that I would not allow to have surgery done here, because I would want them to be monitored in a hospital setting if there were any complications. So people that have what we call comorbidities, if they have like pulmonary fibrosis, difficulty breathing, once again, we have a criteria here of clearing patients for surgery, and if we don't feel they meet our strict anesthesia safety guidelines, we will take those patients back to the hospital and do them in that setting. So, so it just really depends on each patient's health and history, and if they're a lot of people that are on blood thinners, those are patients that will have to work with their cardiologist to hold their blood thinners before surgery. So that would be another metric that we would heavily look at.
Excellent. And the next two questions coming for you are both about Rosa. So the first one is, how does Rosa benefit the patient?
It benefits the patient by having less surgical disruption to your bone and soft tissue. We are making greater, more accurate incisions in your bone and your soft tissue, so you have less pain postoperatively and more ability to have your life back with quality of life, where your knee will have flexion, extension, stability, and again, very reduced amount of need for pain medications postoperatively.
And is Rosa the next generation to the Da Vinci robot?
That's a great question. It is not. The Da Vinci is a totally different type of platform. I've used it when I have run departments in hospitals. We've had the Da Vinci. That would be something I would love to have here someday, and I would use it with my urology surgeons. But the Da Vinci is used typically in an inpatient hospital setting for laparoscopic procedures, general surgery procedures. Rosa is designed uniquely for orthopedic procedure of total joint replacement implant.
Very interesting stuff. All right, so the next one is, how bad does a knee have to be to qualify for a total knee replacement?
Another very good question. So it really depends on your tolerance level for pain. As we age, our bodies lose the cushion that we'd like to have when we were younger. And so a lot of the things that drive patients to make that decision and pull the trigger to elect for surgery is the bone-on-bone pain that you have with arthritis. And you know when you have it, because frankly, when you start hurting arthritically anywhere in your body, it will not stop. Once it starts hurting, and I'm speaking from experience as well, along with me being a nurse and doing this my entire life, but once your joint starts hurting, you're limping, you have difficulty in the morning getting up, you know, when you wake up and you just stand up and you start to try to ambulate and you're just kind of like caught with that, you're reminded of your limitations. It's when you get to that part of your life when you say, you know what, we have the technology, we have the ability, I would really like a higher quality of life. So that is usually what is the motivating factor for people to seek this out. And literally, everybody will come post-operatively and say, I wish I had done this earlier.
And are there different levels of knee replacement?
That's a great question. Yes, there are. So we can do a surgery called uni knee, UNI, where we only replace one part of the knee that is having the bone-on-bone issues. So what we'll do, to give you a little illustration using my fist here, is we'll just put a metal cup over the end of that part of the joint so that you don't have that bone-on-bone pain. You now have a titanium piece covering that, so you're not having that rub arthritic pain. So it's very minimally invasive. We don't need to take your whole joint. We don't need to make a cut in your femur. So if a patient is just having one part of their knee rub, but not the other, we will just go and cover that one part of their knee. So we're advocating for minimally invasive surgery. We're not here to say you need a total knee if you don't. That's a good way to start, is if you need the uni knee, have it. And then as you age and your joint continues to wear and tear and you need the knee replacement, then we already have that component in there. We go in and we revise it. It's called a revision. And we add the next component so that you then convert to a total knee replacement.
And is total really total?
Yes. So we don't remove your patella, of course, but we will take, we'll make a cut in your femur, and then we make the cut on your fibia, and then that's where we have the two pieces that we implant, and it's implanted on your femur and on your fibia. We put your kneecap back where it needs to be, and then we suture the muscles and the skin and the incision, and we get you up about 2 hours after surgery to get you moving.
Wow. Does the Rosa reduce the recovery time?
Yes. So the recovery time, not in my facility here in the recovery room, but your overall recovery, because of the accuracy of the placement of the implant, you are able to get up, ambulate, and have more movement and less pain a lot sooner than conventional knee replacements.
If you had problems, would you see your doctor and get referred to you, or would a patient come directly to you?
Patients are welcome to come directly to us. So we have what's called a portal, and you all are all tech savvy, as I can tell by this meeting here on Zoom. You can go to our practice portal, and you can actually secure an appointment with one of our orthopedic surgeons. There's no middleman, so to speak.
I'm going to actually jump down and allow you a minute if you're willing to do this. We do have someone that's asked a question about your contact information, especially your phone number. I don't know if you feel comfortable, you can post it in the chat box,
Okay.
or we can post it in the chat box for you and get that contact information.
Sure. To be honest, I'm never at my desk because it's such a dynamic business. So my assistant would probably answer any calls or voicemails, but what I would recommend is anyone email me. I'm very responsive to email, and I'm happy to facilitate any recommendations, any further questions. So I monitor email like a hawk on the fly too. So I'm happy to share my email with anybody.
If you don't mind, Janet, I'll post it in the chat box here.
That'd be great.
Okay.
That's perfect.
Post that right now. Bear with me a second, folks.
Happy to do it. And I also have a LinkedIn page. You're welcome to look at my LinkedIn page. It has all the data about my surgery center. And then furthermore, the surgery center has its own LinkedIn page and Facebook page with a lot of information. We've been published the last 3 months in national publications about this technology. So I've posted those articles on our website as well and our Facebook page.
Excellent. So I've just put your email address in the chat box. If anybody would like to write that down, feel free.
Feel free, and just let me know that you're part of the Rotary, and that'll let me know how you got my information so I can make sure I'm answering your question accurately.
Excellent. We got a few more questions here for you.
Great.
And we do appreciate the questions. This is great. This is
I love it.
A very interesting topic.
Bring it on.
I like it. So what if your knee, let's see here. What if your knee, due to conditions of the pain, is not in the best position for your body? Does it return to your birth frame?
We will adjust the new knee, using new meaning your implant, new robotically placed knee. We will adjust it so you have the maximum flexibility, like I said, flexion, extension, and ability. So we will correct for a lot of those things that people have had arthritic changes, or they were born with certain degrees of valgus or varus is how your leg will bow in or out, is what that means. So we will correct for that as much as possible.
Is the Rosa mobile?
It is. So Rosa has wheels. And so once we are finished with the robot, as far as the measures, the cuts and everything like that, we will take it out of the room, clean it, because the arm of the robot is draped in sterile drapes. And so everything is sterile in our procedures. We'll remove the sterile drape, clean the equipment, and she can be rolled into the next room where they're ready for the next surgery.
This is a comment here, not a question. My two sons have had knee surgery with Dr. Rob Dasilva years ago, and we're very happy.
Excellent.
Great surgeon, and
Yes.
better yet, thinks he's a gamecock. So
Even better. I love it. Dr. Dasilva is one of our orthopedic surgeons, and he specializes in total joint replacement as well. And he's excellent. All of our surgeons here, no matter their specialty, I require them all to be board certified. And that's significant because not all physicians are board certified, number one. Number two, if they are board certified initially in their practice, some of them don't keep it up. So every 5 years, they have to requalify, and that is a requirement of my surgeons, which keeps them up to date and in the know about all the latest and greatest advances in technology and medicine.
excellent. And I will put this message out there in respect for your time. If you have a question, please go ahead and put that in the chat box, because there's about 6 or 7 in line right now. So we want to make sure you get your question answered. So please post that in the chat box.
Go for it. I've got time. No problem.
All right. So does the Rosa cut surgery time? And then what is the average time of surgery?
Another great question. So as we're learning the technology, obviously we are going slower because we want to make sure that we are learning it and we're taking our time with it. And that once we do one case successfully with a surgeon, we'll start to do 2 and 3 and 4, but we want everyone to be comfortable using the technology without rushing. So that's why we've got a very rigorous training ahead of utilizing the equipment. So when I first started using it, it actually added time to the cases, and I was fine with that. I anticipated that because I don't want anyone to rush here, not ever, not when we're in surgery. So it was more time consuming. Right now we are time neutral with it, and so it's no different if I was doing a conventional knee replacement or a robotic assisted knee replacement. I do anticipate it will cut down on our times, probably by 10 minutes, which doesn't sound like a lot, but when you run a business like this and you have patients here, for my team to get in and turn the room over, sterilize the room, and get the next case set up, 10 minutes is a big thing.
Absolutely. Do you produce the replacement hardware?
Great question. I do not. So the people that manufacture and design this robot is a company called Zimmer Biomet, and they are based out of Warsaw, Indiana. They have initially made a spine robot that was technology from France. And so Zimmer Biomet bought that partnership from France and then has worked with the engineers with their company who creates the implants. They also created the robot. And so it's an exciting project because they take the best engineers and technology minds around the world. I've personally been on phone calls with design engineers and the IT people from Montreal, France, and Indiana. So Zimmer Biomet, to answer your question in short, Zimmer Biomet is the company that produces the implants.
Gotcha. Any movement towards 3D printing for hardware?
Absolutely. That's the next phase of our world in orthopedic and spine surgery, where we have the ability to create custom implants from a 3D printing model and use those in your anatomy for surgery. That's already in the works.
Do stem cell injections help return the cushion?
That's a great question too. So it's called PRP. But so people are using that and they're having great results for soft tissue injury. It will not help bone, however.
Tell us, who are some of your competitors?
Well, you know, the big hospital systems are my competitors, frankly. So the Lexington Medical orthopedic surgeons would be one. The next would be the Prisma Health orthopedic surgeon. So I'm competing against the big hospital systems.
And the last question I have for you here in the chat box is, has COVID affected the number of surgeries you've been able to do?
Absolutely. Another great question. And as a leader here, as a clinician, 2020 has been the challenge of my career and my professional life. And so we shut down the end of March for 2 weeks because we did not know what we were facing, and we were wanting to be respectful of the governor's request. And I went into emergency planning phase because our center, in theory, could be used to decompress the hospitals. So the upside of COVID is that the federal government has now recognized that there are thousands of ambulatory surgery centers around the nation, and we're like a small army of hospitals. And so we've gotten a lot of visibility because of that. But we were prepared here to take patients as overflow patients, or we were prepared to turn this into a facility for labor and delivery, where we would have all women that were delivering come here to stay out of the hospital. So our business was impacted significantly. Like I said, I closed our doors for 2 full weeks until I could secure the N95 respirators that we all have to wear here. And then we opened up for 4 weeks, but only 2 days a week, so we could do urgent emergent cases. So people that had spinal herniations and disc issues that were affecting their ability to walk, ambulate, any sort of impingement on spine, we were doing those urgent cases. And then any people with, of course, no one plans to break an extremity and have to have all the pieces and parts put together. So any acute trauma, we were using the time to fix those people so they did not have to go to the hospital. I began running operationally the end of April, and the impact has been significant because we do high volume surgeries here, but the silver lining of COVID is that more and more patients are wanting to elect to come to our spaces because we do not care for any COVID patients here. So we're healthy, we're clean. Again, we're elective. There's nothing urgent or emergent about it. It's planned. And so we've seen a big uptick on the patients that want to be done in our spaces.
Excellent. Well, thank you for your time this morning and sharing a lot of knowledge about
You're
this
welcome.
really remarkable kind of thing that's
Thank you for having me. I'm excited. This is great. I appreciate the opportunity. And of course, anyone is welcome to email me. I will be happy to get back with you. So I hope you all have a wonderful weekend, and thank you for having me.
You're welcome. We do appreciate it. So in closing, I said at the beginning, it was all those national days, right? So it's National Take Your Parents to Lunch Day. It is Department Store Day. It is National Bosses Day. So Janet, people should be doing things for you today.
I'll have to tell them that because I bought them lunch today from Mellow Mushroom because we're so busy.
Well, looky there. Mary, where's the cat? Because it's Global Cat Day. It's National Liqueur Day. It is National Mammography Day, and it is National Sports Day. Upcoming speakers. We talk about the speakers we do on Monday, Wednesdays, and Fridays as part of conversations with Rotary Action people. So coming up on Monday, those of you that like to cook, you do not want to miss Monday, as Natalie Dupree joins us on Monday. Then on Wednesday, we'll hear from Angela Drake from the Daniel Island Rotary virtual duck race. That'll be interesting, how you can do a duck race virtually. I can't wait to hear about that. And then next Friday, we'll have Major General Craig Weldon talking about restoring the Pentagon after 9/11. And a 2-week notice that on Friday, October 30th, we will not have a speaker. However, we will have a CWRAP that will be all filled with Halloween trivia. So come in costume, know your Halloween trivia, because you could win some prizes. So we do thank you for being here. And then one final announcement. It is on the front page of DACDB, but it looks like there is a bingo night for polio coming up on Monday, October 19th, beginning at 7 o'clock. Looks like cards are $5 each. And all the information about that event is on the front page of DACDB. Plus, there was an email that went out to all Rotarians yesterday in the district. So hope you guys have a wonderful weekend. I will close down Friday with the 4-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thanks again, Janet. Hope everyone has a wonderful weekend. See you on Monday for the next conversations with Rotary Action people. Take care. That's a wrap. Bye-bye.